Thank you for joining us to discuss using Aquifer for longitudinal integrated clerkships. Aquifer cases walk learners comprehensively through each step of a patient encounter, from history, physical and labs, through developing a differential, ordering additional studies, forming a final diagnosis, then treating and managing the patient. Throughout this process, core content learning objectives are met through meticulously mapped teaching points, such that by the end of the course, all of the relevant national objectives have been covered. Cases provide in depth and engaging teaching along the way, much as you would expect from an expert preceptor, asking students questions to check and correct their knowledge before moving to the next step. Educators often share that they assign students cases containing topics normally covered during the didactic session. Classroom time then goes deeper into a topic, whether discussing different but related cases or discussing actual patient encounters related to aquifer cases. We know educators are busier than ever, which is why we've created the AI Assistant chatbot. Educators often ask, how do I find the right cases? What's the best way to integrate them in the curriculum? The chatbot answers these questions instantly, no waiting for email replies or searching through documentation. Simply type your question in the text field, and the chatbot will recommend Aquifer cases for your clinical rotation or course, provide strategies for using cases in small groups, flipped classrooms, or independent study, and help you plan a course with the right cases across your curriculum. We know there are circumstances in which educators want to have a greater ability to filter and retrieve case results. The content library provides advanced content searching across all cases and or integrated illness scripts that are aligned to your subscription. The detailed content list displays information including synopses, case summaries, learning objectives, and integrated illness script mechanism of disease maps with one click. The content library includes a series of drop-down filters, including clinical discipline, body system, patient age, location, clinical focus, and the Aquifer content aligned to your subscription. You may also search by condition and diagnosis, basic sciences if your subscription aligns to that, as well as clinical excellence curricular threads should your subscription align to that. Aquifer cases and scripts are written and continuously updated by expert health profession educators who make up the Aquifer Consortium. The date the content was last updated are displayed for each item, so you can be sure your students are being provided up-to-date content written by your trusted peers. Consider using Course Builder to assemble your case and script choices into one package, or Course Builder. You can assign specific Aquifer cases and scripts to students, track your class or cohort progress at a glance, and include course-specific information or directions for students. Save time by using our duplicate course feature, which allows you to copy content and or users to a new course. The QR code will take you to the webpage with more specific step-by-step details for creating Course Builder. So how are programs using Aquifer for a LIC? Rather than using Aquifer cases as static assignments, faculty at a Northwest medical institution intentionally leverage them as a starting point for advanced clinical reasoning. Students completed 2 to 3 cases per week independently, ensuring deep familiarity with the case content before group discussion. In small groups of 4 to 6 learners, a physician preceptor guided discussion and then deliberately altered key aspects of the case, such as historical details, social determinants of health, and or physical exam findings. Students were asked to step back, reconsider their prioritized differential diagnoses, and justify how and why those changes altered clinical decision making. For example, the care of a 24-month-old patient with maculopapular rash would yield different differential diagnoses if the child was immunized compared to an immunization schedule delay. This approach aligned well with the LIC's existing case based learning framework. Students used Aquifer's integrated illness scripts to help reinforce foundational science to support their higher order clinical reasoning. Importantly, Aquifer functioned as a longitudinal learning scaffold across all 6 core clerkships and mapped directly to the program's core EPAs for entering residency. This example demonstrates how Aquifer can be used not only to replace lost clinical exposure, but to intentionally deepen clinical reasoning, promote peer to peer learning, and maintain rigor for advanced learners in longitudinal clerkship models. At a private Northeastern medical school, the LIC director wanted to better support students during one of the most difficult transitions in medical education, the move from preclinical learning into real clinical environments. They used Aquifer's clinical excellence cases to build an entire orientation course without needing an additional subscription or new content creation. Students completed 15 Aquifer cases asynchronously over 10 days, overlapping with orientation week. Because Aquifer handled foundational concepts like patient safety, diagnostic excellence, high value care, and cultural awareness, the program was able to protect in person time for activities that truly require face to face engagement, such as basic life support orientation, SIM lab sessions, EMR training, and expectations for professionalism. An added benefit was longitudinal impact. The clerkship director intentionally planned to revisit several Aquifer topics later in the year, reinforcing that orientation wasn't a one time event, but the start of an ongoing developmental process. Here's an example illustrating how Aquifer can be used not just within individual clerkships, but as a unifying longitudinal framework that supports professional identity formation and readiness for clinical learning. Orienting your students to Aquifer will make a big difference in their learning experience. You can help them maximize their learning by sharing some key information to help them get started and understand how Aquifer fits into your plans for your course or clerkship. We've created slides with the basics on Aquifer cases and useful tips for students, ready to drop into your course or clerkship orientation. Using this QR code takes you right to PowerPoint slide deck. We're excited to offer you a personalized session with an experienced health professions educator who actively uses Aquifer in a variety of learning environments with different levels of learners. Curricular consults can cover a range of teaching suggestions, integration strategies, and guidance. Each consultation will be customized to your specific needs, with the goal of getting you quickly up to speed and making the most of your subscription. Scheduling a consultation is quick and easy using this QR code, which takes you right to the scheduling page. We look forward to connecting with you soon and learning more about how we can best support your curricular needs.